Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Cariprazine. Its brand name is Vraylar. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Cariprazine is an atypical antipsychotic agent. It is a partial agonist at serotonin 5-HT1A receptors as well as dopamine D2 receptors. And it also has antagonistic effects on serotonin 5-HT2A receptors. In terms of indications for use, Cariprazine can be used for the acute treatment of mixed or manic episodes seen in bipolar 1. And it's also indicated to be used in the treatment of schizophrenia. Now before somebody was to use Cariprazine or Vraylar, there are some precautions and warnings that they should be made aware of. So Cariprazine is on the Beers criteria, which is a list of medications that the elderly population should either avoid or use cautiously. This medication may put this population at an increased risk of experiencing SIDA or hyponatremia. It could also put them at an increased risk of falls, which in this population may lead to fractures. Orthostatic hypotension, as well as syncope, may occur in patients using this medication. This would more commonly occur during initiation of therapy, as well as each time the dose is increased. Hyperglycemia is a possible side effect of atypical antipsychotics, and in some situations it is associated with ketoacidosis. So patients with diabetes or who have risk factors for developing diabetes should be more closely monitored. Patients should be made aware that metabolic changes may occur, such as weight gain or dyslipidemia. Patients should also be made aware that while using an atypical antipsychotic, they may notice that they lose the ability to control their core body temperature. So they should use caution when they're doing things like strenuous exercise, if they're exposed to heat, or if they may be dehydrated. Dysphagia may occur with the use of this medication, which could lead to aspiration, and in some situations could also lead to aspiration pneumonia. Fatal agranulocytosis has been reported with the use of antipsychotics. Patients using Cariprazine may experience neutropenia or leukopenia. They would be at an increased risk of experiencing this if they have a history of drug-induced leukopenia or neutropenia. Patients should also be made aware that occasionally side effects with this medication take a couple weeks until they appear. These are considered late occurring adverse effects, and the thought here is that it takes time for Cariprazine and its metabolites to accumulate. Potentially life-threatening neuroleptic malignant syndrome has been reported with the use of antipsychotics. Tardive dyskinesias have been reported with the use of Cariprazine. Patients would be at an increased risk of this if they are elderly, especially in elderly women, as well as patients treated with higher doses for longer durations of time. And finally, for precautions, patients should be made aware that motor and cognitive impairment may occur, which may affect their ability to perform hazardous tasks, such as driving an automobile or operating heavy machinery. So when somebody is using Cariprazine to treat their mixed or manic episode, seen in bipolar 1, they would use 1.5 milligrams once daily on day 1, and then 3 milligrams once daily on day 2. Further adjustments will be made in increments of 1.5 or 3 milligrams as needed. The maximum dose would be 6 milligrams daily. When patients are using Cariprazine to treat their schizophrenia, the dosing would start off the same, 1.5 milligrams on day 1, 3 milligrams on day 2, and then adjust as needed. The difference is that in bipolar, the usual maintenance dose is somewhere between 3 and 6 milligrams. With schizophrenia, it can be between 1.5 and 6 milligrams. As with all medications, there are some side effects or adverse reactions that patients may experience while using Cariprazine or Vraylar, so I'll go over some of those here now. Indigestion can happen up to 7% of the time, and up to 10% of patients may experience vomiting. Akathisias seem to develop in 20% of patients treating bipolar and 9% of patients treating schizophrenia. Between 5 and 8% of patients experience somnolence, and restlessness seems to happen in between 4 and 7% of patients. Some more rare but serious side effects would be esophageal dysmotility, leukopenia and neutropenia, pulmonary aspiration, the development of suicidal thoughts or ideation, and finally, neuroleptic malignant syndrome. That's all we're going to talk about today with Cariprazine or Vraylar. As always, I'm thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.